The committee will come back to order and now call up the activity report and ask the clerk to report.
Activity report of the Committee on Energy and Commerce, U.S. House of Representatives, January 5th through May 31st, 2011.
And without objection, the first reading of the report is dispensed with, so ordered. And the chair will recognize himself very briefly. Under a new House rule, our committee is required to file a semi-annual activity report. It's an important part of the Republican leadership's transparency and accountability efforts. That said, this should not be a partisan exercise. We are reporting to the House on what the committee has done. The activity report that I have circulated does just that. There's no soaring partisan rhetoric. There's no grandstanding about our accomplishments. And I would note that the minority has filed 10 amendments to the activity report. I further note that all 10 of those amendments seek to amend the oversight plan that this committee approved over 4 months ago by a voice vote and obviously on a bipartisan basis. Apparently, we are accused of operating on a partisan basis at almost every turn. I dispute that and may discuss that topic more later on. What is abundantly clear today, though, is that the minority is turning perhaps what should be almost a perfunctory, nonpartisan event into something more than that, i.e. partisan. I would yield back at this time and ask if there are, I'll recognize the chairman for what purpose?
Opening statement?
Opening statement, chair is recognized for 5 minutes. Strike the last word.
Strike the last word. Yes, Mr. Chairman, I'll try to be brief as well. We have found the committee activity report generally accurate in chronicling the meetings and hearings and markups. We have some technical corrections for accuracy, and we hope they can be accepted. And we will have amendments to offer to ensure that the committee is protecting the health care of seniors, the disabled, and children. The fact of the matter is that this committee has accomplished virtually nothing since January. It is there on page 9 of the report. Total bills and resolutions referred to the committee, 417. Bills and resolutions reported to the House, 12. Number of public laws, 0. For all of its labors, this committee has decisively failed to meet some of the most urgent needs of the American people today, to pass into law legislation that will promote jobs and job growth for the country. Instead, the committee leadership has followed an extreme agenda across the committee's jurisdiction. On health care, this committee has voted to strip benefits from seniors, the disabled, and children. It has passed legislation that repeals basic consumer protections and would allow insurance companies to discriminate against individuals with pre-existing illnesses. The Republican agenda has been to end Medicare and Medicaid as we know it. This is not a record for which we ought to be proud. On energy and the environment, the record is no better. This committee room has become an alternative universe where the laws of nature cease to exist. It is an embarrassment that the committee voted that climate change is not occurring, is not caused by man, and is not a threat to health and the environment. I have offered to work with my Republican colleagues on a bipartisan basis on many bills, including the Chemical Security Bill, the OCS bill, and the coal ash bill. But these overtures have been rejected again and again. We can continue down the path we're on, or we can try to find some common ground. We can end up with no major legislation emanating from this committee enacted into law, or we can forge bipartisan consensus and achieve something for the American people. There are areas where I hope we can find a bipartisan solution. One is toy safety. Another is privacy. The third is spectrum allocation and public safety. I hope we seize these opportunities. So I believe this should be a moment for reflection and reassessment of the course we are on and of what we truly want to accomplish in this Congress. Our country needs leadership from Congress, from both parties, not divisiveness and partisanship. And I yield back the balance of my time.
Okay. Other members wishing to strike the last words? If not, we will open the bill up for amendment. Are there any? Yeah, we already, yeah, I think we're at that point. Are there any,
Just point of information. Is the committee report considered and read open for amendment at any point?
yeah,
Okay,
yes. So I did that. I recognized myself briefly as you did, and it's open to amendment. Are there any bipartisan amendments? Bipartisan amendments? You got one? Are there any other, seeing none, are there any other amendments? Gentleman from New Jersey, Mr. Pallone, is an amendment at the desk?
I believe so.
And
Amendment number 3, health.
clerk will report title of the
It's
amendment.
about S-CHIP and Medicaid.
An amendment offered by Mr. Pallone of New Jersey.
The amendment will be considered as read. The staff will circulate the amendment, and the gentleman is recognized for 5 minutes in support of his amendment.
Thank you, Mr. Chairman. I'm concerned about the harms of the Republican budget on children in Medicaid and CHIP, so my amendment would require the committee to examine these issues closely. The Republican budget proposal, which passed the House in April, proposes devastating cuts to programs of importance to our nation's most vulnerable children and families, failing to promise a brighter future for the next generation. Medicaid and the Children's Health Insurance Program, or CHIP, cover nearly 30 million, or one-third of all America's children, and over half of low-income children. Medicaid and CHIP provide children with comprehensive medical services to address physical, mental, and developmental health needs. Children represent half of all Medicaid enrollees, yet they account for only 20% of the spending. Through Medicaid and CHIP, the country has successfully reached the highest rate of insured children on record. 90% of children in the United States have health coverage. In the Republican budget outline for fiscal year 2012, they have proposed to end the Medicaid entitlement, instead providing fixed dollar amount funding to states through block grants. Specifically, it proposes to slash $771 billion out of current Medicaid and another $627 billion out of Medicaid as part of health care reform, for a total of $1.4 trillion in federal Medicaid cuts. With these types of cuts, it's near certain that funding for states would be far lower than under the current financing system, jeopardizing coverage and protections currently guaranteed for children and other vulnerable populations. In fact, what's even worse, by eliminating the Affordable Care Act, the Republican proposal would effectively repeal funding for CHIP, a program which provides health coverage for more than 7 million children and has the support of 82% of the American public. The proposal appears to anticipate the expiration of the CHIP in 2013, 6 years sooner than currently scheduled, and creates a $150 billion shortfall, which would cause all covered children to have their health care coverage threatened. Now, I think obviously that children are the single largest group of beneficiaries that will be at risk, even though they are the least expensive population to cover. Such potential loss of health insurance has dire consequences for the health of children. Uninsured children are 20 to 30% more likely to lack immunization, prescription medications, asthma care, and basic dental care. Uninsured children with conditions requiring ongoing medical attention, such as asthma or diabetes, are 6 to 8 times more likely to have unmet health care needs. And uninsured children are also more likely than insured children to miss school due to health problems and to experience preventable hospitalizations. If the Republican budget were to be adopted, all progress on children's health care coverage would come to a halt, and the uninsured rate for America's children would likely double or triple in a matter of just a few years. While tackling the national debt is a critically important matter, it must not be done in a way that slashes the basic investments in our nation's children. We must not balance budgets on the backs of kids. So I urge my colleagues to allow this committee to do its job and examine the effects of this budget. And I would ask for an aye vote on my amendment. I don't know if any of my colleagues would like me to yield time. And if not, I will yield back the balance of my time, Mr. Chairman.
Gentleman yields back his time. The chair would recognize Mr. Burgess, Dr. Burgess.
Thank you, Mr. Chairman. I have a secretary amendment at the desk.
The clerk will read the amendment.
Mr. Chairman, I reserve a point of order on that amendment.
Point of order is reserved.
A second-degree amendment to the activity report offered by Mr. Burgess of Texas.
Mr. Chairman, I insist on the reading.
The clerk Clerk will read the amendment.
Strike all and replace with, the committee will examine how many children would lose their current private
Mr.
health
Chairman, I
care
ask the
coverage.
amendment's consent if be considered as read now that I've had a chance to look at it.
Amendment is considered as read. The gentleman will have 5 minutes in support of his amendment, and the staff will circulate the amendment.
I thank the chairman for the recognition. This amendment would ensure that this committee reviews how the president's healthcare reform law repeatedly violated his campaign pledge to ensure Americans are able to keep their health care coverage. In addition, the amendment would ensure that the Medicaid program continues to serve the nation's poorest and sickest individuals. Earlier this week, the Associated Press reported that the president's health care reform law could expand the Medicaid program to include middle-class Americans with incomes around $64,000. If such a dramatic expansion of Medicaid is implemented by this administration, 1 in 4 Americans will become a Medicaid recipient. It doesn't sound like health care reform. This dramatic expansion will not only cost the federal and state government billions, it could also have effects on access to care for the nearly 60 million existing Medicaid beneficiaries who already face tremendous challenges in finding someone to actually see them when they are ill. We're all well aware of the provider shortage created by the lack of satisfactory reimbursement in Medicaid. In addition, because of not even the potential crowd out, the very, very real phenomenon of crowd out, resulting from the overexpansion of entitlement programs in the Patient Protection and Affordable Care Act, Americans, mostly children, could lose their current private health insurance and be forced into Medicaid or the Children's Health Insurance Program. During the campaign, as a candidate, the president promised reform. In reality, his reform plan is an overexpansion of already strained entitlement programs and a path toward really what is going to amount to a government takeover of our healthcare system. So I ask my colleagues on both sides to look at this critically and support the secondary amendment that ensures that the Medicaid program is preserved for those for whom it was designed, the most vulnerable citizens and individuals with private health care insurance could indeed take the president's promise to the bank, if you like what you have, you can keep it. I'll be happy to yield to anyone else on either side. If not, Mr. Chairman, I'll yield back the balance of my time.
Gentleman yields back. Does the gentleman from California insist on his point of order?
Mr. Chairman, I do have a point of order that the text of the amendment offered by the gentleman from Texas is in effect a substitute amendment that should be subject to further amendment. According to the House Practice Manual, Chapter 2, Section 14, quote, a perfecting amendment should retain some portion of the substitute so as not to be, in effect, a substitute in the third degree, end quote. We've talked with the parliamentarians about this principle, and what this means is that when text of an amendment does not retain some part of the underlying amendment, it is in effect a substitute. The amendment offered by the gentleman strikes out the entirety of the underlying amendment and is therefore in effect a substitute, not a perfecting amendment. Therefore, the chair, in my point of order is not to rule the proposal out of order, but to recognize that the amendment that is now being offered is a substitute and would be open to further amendment.
So does the gentleman withdraw his point of order that it's not germane?
I didn't have a point of order that was not germane. One second.
He reserved a point of order. Yeah. So you do it. So do you withdraw your point of order?
Well, I withdraw my point of order in terms of germaneness, which I never intended to make. I just wanted an understanding that the amendment is not a perfecting amendment, but a substitute amendment. Chairman agrees to that?
So this amendment then is germane to the, as a substitute to the amendment that was offered.
Well, the other part of the statement was that the amendment is germane, and that while the chair would not make a declaratory judgment on a parliamentary matter, but it will proceed.
All right. So,
I withdraw a point of order.
gentleman
this
withdraws his
point.
point of order, and discussion now is on the Burgess amendment.
Mr. Chairman,
Mr. Chairman,
I have an amendment to the Burgess amendment, substitute.
I want to reserve a point of order
Right. Mr. Gentleman from Texas,
on
Mr.
Mr.
Barton
Pallone-
reserves a point of order
on
on
Mr. Pallone's amendment to the amendment.
Pallone.
Thank you, Mr.
Do you have
Chairman.
it- Is it at the desk?
Well, I have to read it. Is it at the desk?
And that's Mr. Chairman, if my understanding of the rules, if the amendments are not at the desk at least 2 hours before, they can't be offered.
Yeah, but how did we know what you were doing? Burgess wasn't there either.
No, if you're
His was there at the beginning of the markup.
That's not a rule. That was a rule of recognition only.
I
It
think
is.
Mr. Pallone's amendment is allowed. So the clerk
The-
will report the title of the amendment.
Amendment to the Burgess substitute offered by Mr. Pallone.
Without objection, the amendment will be considered as read. The staff will circulate the amendment, and the gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. The amendment is very simple. It simply says that the committee will examine how many young children would lose Medicaid and the Children's Health Insurance Program under the Republican budget. And so basically what, this goes back to the concern that I expressed in my original amendment, which is that, and I'm not going to repeat the same thing again, which is that because of what's proposed in the Republican budget, my fear is that many young children who are now Medicaid eligible under the current law and under the CHIP program would simply lose their eligibility and would go into the ranks of the uninsured. Unless someone else wants my time, Mr. Chairman, I'll yield back.
Is there further discussion on the...
From Florida, I yield to the gentlewoman from Florida.
I thank the distinguished gentleman, and I just want to speak in favor of your amendment and say, well, thank goodness for Medicaid and how important it will be that the GOP budget relating to Medicaid be defeated, because we have families all across America who rely on Medicaid for their basic health care needs. And when you hear Medicaid, we're talking primarily about children in foster care, pregnant women, and even seniors in nursing homes. And I'm afraid this GOP budget comes at such a difficult time for our country. We have many families that have had to come, mostly children, pregnant women, have to come on to Medicaid at a time when we're in the middle of this huge economic recession. Maybe someone in the family has lost the job, and that's resulted in a decline in the family income. Many of these families, the kids come on to Medicaid on a temporary basis, or CHIP on a temporary basis. This is a very important safety net, and this GOP budget needs to be examined for the impact it's going to have on American families. Families USA also released a report this week that shows what a double whammy this will be, because under the GOP budget and the cuts to Medicaid and health services for children, we're also going to lose thousands and thousands and thousands of jobs all across the country. And just ask your local hospitals, doctors, nurses, they know what the resulting cuts from the GOP budget will do to jobs. In my state of Florida alone, this Families USA report said simply thousands and thousands of jobs are going to be put at risk by the GOP budget because of cuts to health services under Medicaid. So I think this is a very important topic for the committee to examine, And I salute Mr. Pallone for encouraging us to examine how many children will lose their health care. Maybe we should say how many Americans will lose their jobs as a result of the GOP budget relating to Medicaid as well. I yield back.
And will the gentleman further yield?
Yes, I yield to the gentlewoman from Illinois.
Okay, let's see what we're actually talking about here that's in jeopardy because of the Republican budget, and that's why we should examine it. Medicaid and the Children's Health Insurance Program cover nearly 30 million, or 1/3 of all American children and over half of low-income children. Medicaid and CHIP provide children with comprehensive medical services to address physical, mental, and developmental health needs. Children represent half of all Medicaid enrollees. They account only for 20% of the spending. Though Medicaid and CHIP, through Medicaid and CHIP, the country has successfully reached the highest rate of insured children on record. 90% of children in the United States have health coverage. That is now at risk because of the Republican budget. According to the Center for Children and Families, there are an estimated 14.1 million children covered at state option through CHIP or Medicaid, all of whom would be at risk of losing coverage. So we need to be fully aware when we pass legislation of exactly what the impact will be on the children of our country and the people of our country. And I want to speak in favor of this Pallone amendment that requires that we do just that in the legislation, in the amendment. And I urge support for the Pallone amendment to the amendment to the amendment, or something.
Gentlemen's, you'll back your time? Are there other members wishing to speak on the amendment? Dr. Burgess is recognized for 5 minutes.
Mr. Chairman, thank you for the recognition. This is not a clash of ideologies. This is the application and not the theory. The Republican budget is an aspirational document. It still sits over in the Senate awaiting Senate action. The Senate is likely going to take no action because they never do. As a consequence, a unified budget resolution is not likely to come before the House of Representatives in this year or next. But we do have the Patient Protection Affordable Care Act, 2,700 pages of detailed instructions to the federal agencies that even as we speak are grinding out rule after rule after rule. And what did we find yesterday? $64,000. A couple that earned $64,000, if there's an income adjustment because they happen to receive their income off Social Security, they now, not only are they eligible for Medicaid, they're required to take Medicaid. The numbers of people on Medicaid, middle-class individuals pushed onto Medicaid in this country, is going to be unlike anything we've ever seen. What do you think is the practical effect of that when you do not have enough providers today to see the Medicaid patients that show up, the patients that want to go to the doctor's office, because we're not paying our doctors to see our Medicaid patients? And then we double down and vastly expand the system. How do you think that's going to work out? You are, of necessity, going to be driving off the poorest and the most vulnerable citizens off of those rolls. This amendment, my amendment, prior to its subsequent amendment by Mr. Pallone, was merely to preserve the access for that vulnerable segment of the population. Now, later on, if you want to talk ideology, we can do that. We do that on this committee all the time. But we've got a very harsh reality staring us in the face, and that is the Affordable Care Act. That is an act that violated every pledge the president made to the people of the United States when he was running for the highest office in the land. And we did not properly vet that in this committee in the last Congress, and as a consequence, we're stuck with those consequences now. And again, I must reiterate, even as we speak, at every federal agency at every level, some bureaucrat is cranking out a rule or a regulation. You talk about job killing. Look, Medicaid was never intended to be an economic development program. I know some people believe that it was, but you talk about a job-killing activity, that is the Affordable Care Act. That is the Affordable Care Act rulemaking process that is going on right now. That's the deference to go to final proposed rules without even a period of public comment. That's what's been evaluated year. Amendment to the needs to be struck. I would like to see a vote on my substitute to the original amendment. I think that's the appropriate place for us to go, and I'll yield back the balance of my time.
Dr. Burgess controls the time. Oh, he did.
I'd like to be recognized. First of all, let's look at the Burgess Amendment. The Burgess Amendment says we're going to look at how many children would lose their current private health care coverage and be forced to enroll in Medicaid and the Children's Health Insurance Program under the President's Protection and Affordable Care Act. Well, I can tell you the answer to that right now. None. There's nothing in that law that says that a child that has private insurance has to give it up to go into CHIP or Medicaid. The only ones who are going to be in CHIP or Medicaid are kids who before now have no coverage at all. Second part of your amendment I don't find offensive except for what the implications are. It says committee should examine the negative implications of expanding Medicaid to the middle class and what that will have on the ability of low-income children to access care in the Medicaid program. Well, I assume you're talking about the middle-class seniors. Are you talking about the middle-class seniors?
Well, in fact, under provisions of PPACA, anyone who falls into those income levels has to, they don't have an option to get a subsidy in the exchange. They have to go into Medicaid. So
Yes, that's up to 133% of poverty. 133% of poverty. How much? 17,000? $14,000 a year. If you're worried about somebody who has $14,000 a year in income being called middle class and crowding out low-income children, I think there are other things to worry about. But that's the Burgess Amendment. Now, what Mr. Pallone would have us look at is the kids who are going to lose their Medicaid and CHIP benefits under the Republican budget. Well, that's worth looking at because the Republican budget would take Medicaid and make it into a block grant and then cut it severely, and then the states would have the ability to decide that they don't want to cover kids any longer. They could say the kids that are now covered under Medicaid or would be covered under Medicaid under the Affordable Care Act will no longer be eligible for it. So I think we ought to look at that because I believe if the Republican budget became law, we will have many, many more uninsured people than if we left the law as it is. Now, why do I say that? Because we have 45 to 50,000 uninsured now. And the purpose of adopting the Affordable Care Act was to give these people a chance to get health insurance. Some of them didn't have health insurance because of previous medical conditions, and even if they could afford to buy it, they were denied it for the individual policies. The Republican answer for that was nothing. There was no answer. There's never been a proposal. Maybe to a high-risk group, and the insurance would cost more. And then maybe these people could afford it, and if they couldn't, they're out of luck. There are a lot of people who have no insurance because their employers don't offer it. Well, the Republican proposal doesn't do anything to help them. And there are a lot of people who can't afford it. They could buy a health insurance policy, but it's unaffordable. And so the Affordable Care Act tried to make it affordable by giving some tax credits. Well, the fact of the matter is that if you're going to repeal the Affordable Care Act, which is what this committee voted to do, and if you are going to pass a Republican budget that turns Medicaid on its head and makes it a block grant, then we ought to be able to find out what the consequences are, and that's what the Pallone Amendment would have us do. I urge support for the Pallone substitute to the Burgess substitute.
Burgess' time has expired. Are there other members wishing to speak on the amendment? The gentleman from Michigan, the good Mike Rogers, recognized for 5 minutes.
Thank you, Mr. Chairman. I would yield my time to Dr. Burgess.
Thank you, Mr. Rogers. Do remember what a budget is. A budget is an outline. If the Senate were to take up and pass a budget, if the House were to pass the Unified Budget Resolution, the proposals for Medicaid as well as Medicare would be sent back to this committee. The budgetary instructions would come to this committee, and we would fill out the details of that legislation. But make no mistake about it, the details of the Affordable Care Act are well spelled out in 2,700 pages. Those details are being poured over right now by bureaucrats over in the agencies. And if there are adjusted gross income figures that are to be determined, they are making those determinations. That's where the $64,000 question yesterday, that's where that occurred. And I would also point out that under current law, no one knows what the effect is going to be on the employer-sponsored insurance market. We hear figures that vary considerably, but none of us really knows. Part of that is because we never really held those investigatory hearings in the Congress last year, but fortunately this year we are. If the Republican budget were to pass the Senate and be enacted as a unified budget resolution, the instructions for legislation would come back to the committees of jurisdiction where we would write that legislation. And as opposed to the legislative language of the Affordable Care Act, it would be written in the committee. There would be a chance for input from everyone on both sides of the dais, unlike 2009 and 2010, when one side was completely shut out of the legislative process. Both sides would have an opportunity. So the gentleman will have his chance to have those issues fully vetted, but honestly, what we have to deal with now are the effects of a very bad law that got passed by very bad process last year, and it will, despite the entreaties of the ranking member, it will affect the ability of people to receive care in both the Medicaid system, the Medicare system, and every private insurer across the country. I thank the gentleman for yielding, and I'll yield back to the gentleman from Michigan.
The gentleman yield back his time?
I yield back my time.
Gentleman's time is yield back. Gentlelady from Florida. Sorry.
Thank you, Mr. Chairman. On the second degree amendment, I wanted to make another important point when it comes to the Affordable Care Act, because that amendment starts with the committee will examine how many children would lose their current private health care coverage. Well, remember, one of the most important consumer protections in the Affordable Care Act was that new consumer protection, that new requirement that insurance companies cover young people, young adults up to the age of 26, that they're going to be covered by their parents' policies. I wonder if the staff has any data so far. It hasn't been in effect long, but it's one of the most popular new requirements under the Affordable Care Act. How many thousands of young people now have affordable health care coverage under the Affordable Care Act because of that new provision that says young adults up to the age of 26 can now stay on their parents' policy. Does anyone have that handy? Well, I can tell you anecdotally at home, I hear from families all of the time about what a godsend it has been to have their young people at home be able to stay covered until the age of 26. Oftentimes, when they finish college, they're in that gap period, and it's very difficult. It was very expensive for a young person, whether they were not yet able to find a job or they found a job, to afford individual coverage. So it's made a lot of sense. This is one of the most important consumer protections under the Affordable Care Act, and I would hazard a guess we've got thousands of more young people throughout the country that have gained health care coverage because of the Affordable Care Act.
If the gentlelady would yield.
Gentlewoman yield.
I'm happy to yield.
I thank the gentlelady for yielding. I appreciate her question, and my question for staff would be in a similar vein. Do we have any information on how many companies have stopped offering the child-only coverage because of Obamacare and PPACA? One of the things that we are hearing, unlike what the gentlelady from Florida is hearing, what we are hearing in our office are calls coming in from families who have had child-only policies, and those policies are no longer being offered in the marketplace because of the pressure that has been put on that marketplace and the restrictions due to the passage of PPACA. And I yield back to the gentlelady.
Does the gentlewoman yield time to me?
I'm happy to yield to New Jersey.
Thank you. You know, I listened to what Dr. Burgess said, and what really concerns me is this. You know, in the health subcommittee, I'll just talk about the health subcommittee, we've just had countless hearings about repealing the Affordable Care Act, the health care reform. And all we're really saying in my amendment at this point is, can we have this committee spend some time, or the subcommittee, spend some time looking at what I consider this radical Republican budget and its impact on health care, in this case for children relevant to Medicaid and CHIP. I know a lot of you feel that, and certainly the health care reform was rather significant, but if the Republican budget were to go into effect, I assure you that would be very significant as well. And if anything, I see the Republicans hiding from the budget. I don't even hear that much about it anymore. After they passed it, it was almost like, they passed it and they didn't want to talk about it again. I think that when you pass such an extreme measure that essentially gets rid of Medicare as we know it and makes such severe cuts in Medicaid, that we need to have some airtime. We need to have some time to actually look at what the impact is going to be on kids in this case, and probably on some of the other things as well. This would have long-standing ramifications on the nation's health care, and particularly with regard to kids. I know that CHIP was a bipartisan effort when it first was authorized. There were Republicans and Democrats on it, and I think has done a very good job. 90% of the kids now have coverage. But you change that dramatically in that budget plan. And rather than run away from the budget plan, which I think a lot of Republicans are doing these days, you should embrace it and let us have some hearings and talk about what the impact is going to be, in this case on children. I yield back to the gentlewoman.
And I yield back.
Gentlelady yields back. Are there other members wishing to speak? Seeing none, the vote will occur on the Pallone substitute to the Burgess substitute. All those in favor say aye. Aye. Those opposed say no. No. Roll call is requested. The clerk will call the roll.
Mr. Barton. Mr. Barton, nay. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Pitts. Mr. Pitts, nay. Mrs. Bono-Mack. Mr. Walden. Mr. Walden, nay. Mr. Terry. Mr. Terry, nay. Mr. Rogers. Mr. Rogers, nay. Mrs. Myrick. Mrs. Myrick, nay. Mr. Sullivan. Mr. Murphy. Mr. Burgess. Mr. Burgess, nay. Mrs. Blackburn. Mrs. Blackburn, nay. Mr. Bilbray. Mr. Bass. Mr. Bass, nay. Mr. Gingrey. Mr. Scalise. Mr. Scalise, nay. Mr. Wada. Mr. Wada, nay. Mrs. McMorris Rogers. Mr. Harper. Mr. Harper, nay. Mr. Lance. Mr. Lance, nay. Mr. Cassidy. Mr. Cassidy, nay. Mr. Guthrie. Mr. Guthrie, nay. Mr. Olson. Mr. Olson, nay. Mr. McKinley. Mr. Gardner. Mr. Gardner, nay. Mr. Pompeo. Mr. Kinzinger. Mr. Griffith. Mr. Griffith, nay. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Towns, aye. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Ms. Eshu. Mr. Engel. Mr. Engel, aye. Mr. Green. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Mr. Ross. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Ms. Matsui, aye. Mrs. Christensen. Ms. Castor. Ms. Castor, aye. Mr. Upton.
Votes no. Other
Upton.
members wishing to vote. Ms. Bono-Mack.
Mrs. Bono-Mack, nay.
Mr. Rush.
Mr. Rush, aye.
Ms. Capps?
Ms. Capps, aye.
Ms. Kathy McMorris, Ms. McMorris-Rogers?
Ms. Morris-Rogers, no.
Mr. Bilbray? Mr. Shimkus?
Mr. Bilbray, nay.
Mr. Ross?
Mr.
Are there other members?
Mr. Ross, aye.
Other
Mr. Chairman, what was Mr. Shimkus?
I'm sorry.
Mr. Shimkus, nay.
There are other members wishing to cast a vote? Seen?
Mr.
none?
Chairman,
Oh, Mr. Scalise?
if I could just check and see how I was recorded.
We're okay. Let's just put it down.
Mr. Chairman, Mr. Scalise is recorded as nay.
Okay. Other members? Mr. Harper? No. Let's go.
Mr. Chairman, Mr. Harper is recorded as nay.
Okay. Seeing no other members, the clerk will report the tally. Then we vote. That's right. Mr. Whitfield, how is Mr. Whitfield?
Mr. Whitfield, nay.
Ready for the tally?
Mr. Chairman, on that, there were 15 ayes, 24 nays.
15 ayes, 24 nays. The amendment is not agreed to. The vote now occurs on the Burgess substitute to the Pallone amendment. To the Pallone amendment. Those in favor say aye. Aye. Those opposed say no.
No.
Opinion of the chair, the ayes have it. The ayes have it. The amendment is agreed to. The vote is now on the Pallone amendment as amended by the Burgess substitute. Those in favor say aye. Aye. Those opposed say no.
No.
Opinion of the chair, the ayes have it. The ayes have it, and the amendment is agreed to. Are there other amendments to the bill? Mr. Engel.
Chairman. Thank you, Mr. Chairman. I have an amendment at the desk.
The clerk will report the title of the amendment.
What's the number, Mr. Engel?
It is number 5, I believe.
Which one? Yeah, you're doing number 5, 5 health.
5 health.
An amendment to the Committee on Energy and Commerce Activity Report offered by Mr. Engel of New York.
The amendment will be considered as read. The staff will distribute the amendments, and the gentleman from New York is recognized for 5 minutes in support of his amendment.
Well, thank you very much, Mr. Chairman. I appreciate it, and we all remember back in April of this year when the majority passed its 2012 budget resolution. I voted against the measure for a number of reasons. First of all, it contains massive cuts to the social safety net, while at the same time it protects big oil, protects companies which ship jobs overseas, does nothing to create jobs, and is not something that I could easily support. It almost seemed to me like the majority wanted to roll back the 21st century and use the budgetary crisis or the unbalanced budget or the deficit as an excuse to get rid of every social program they've hated for the past 80 years. And I think that's a very dangerous thing. But more specifically, the Ryan budget attacks Medicare and turns it into a voucher system. It cuts taxes for corporations and the wealthiest Americans while trying to balance the budget on the backs of the poor, disabled, and middle-class Americans. It also takes away health coverage for over 30 million Americans by repealing the Affordable Care Act. It dismantles Medicaid, turning it into a system of block grants, leading up to the point in the future where the cost of the program will dwarf the amount of reimbursements provided to states. So what that does, obviously, is disables Medicaid as we know it as well. So the goal here is to end Medicaid as we know it by setting it up to fail. Medicaid benefits the poor and the disabled, two groups who should not carry the load of balancing the budget. It is, in my opinion, the majority's budget proposal is the culmination of the greatest hits of Republican political issues. During the health care debate, Republicans frightened seniors to the point where they were fearful for their Medicare and urged Democrats to keep their hands off of Medicare. This, of course, was just a political ploy because the fact is that the Affordable Care Act bolsters Medicare and protects its guaranteed benefits. So how did Republicans reward seniors for their votes? By proposing the largest attack on Medicare since its creation. So my bill is very simple, my amendment. It just simply says that our committee will recommend opposition to proposals that result in ending Medicare and replacing it with a voucher, which in essence would double seniors' health care costs in Medicare. In my district alone, Medicaid provides health coverage for over 20,400 seniors and individuals with disabilities who are dual eligible. The Medicaid benefits received by these individuals include payment of their Medicare Part B premiums, coverage of Medicare cost sharing, dental and vision benefits, and long-term care. There are 4,600 nursing home residents in my district, 79% of all nursing home residents, whose care is paid for by Medicaid. Cuts of the magnitude proposed by House Republicans could lead to both eligibility and coverage restrictions for these seniors and individuals with disabilities and put them at risk. So, Mr. Chairman, knowing how many of my constituents will be affected by the majority's proposal, the Ryan budget, I think it's imperative for this committee to recognize what this will mean to seniors, not only in my district, but seniors in every one of our districts on both sides of the aisle across the country. 40 million seniors on Medicare will be affected by this, and we know it won't be good. So I recommend this. I recommend that we oppose the Republican budget proposal, specifically as it reflects to Medicare, again, in opposition to ending Medicare as we know it and replacing it with a voucher, which would take away care for senior citizens, health care for senior citizens, make them pay more out-of-pocket expenses, and puts Medicare in jeopardy. So that's my amendment, very simple, and I thank you, Mr. Chairman, and I yield back.
Gentleman yields back his time. Chair would recognize the gentleman from New Hampshire, Mr. Bass.
Mr. Chairman, I have a second-degree amendment at the desk.
The clerk will report the title.
Reserving a point of order.
Point of order is reserved.
Second-degree amendment offered by Mr. Bass of New Hampshire.
The amendment will be considered as read. The staff will circulate the amendment, and the gentleman from New Hampshire is recognized for 5 minutes.
Thank you very much, Mr. Chairman. And I heard earlier today that this, first of all, I'll start by saying I think it's regrettable that on a routine committee document that's required by a House rule that this debate would degenerate to these types of issues, but that's where we are. And I heard that there was talk of proposing an amendment that would in essence imply that anybody in this Congress would vote to end Medicare, and that's precisely what this amendment proposes. And I considered suggesting to the committee that everybody just vote yes, because there's nothing in this amendment that anybody intends to do. But I thought it might be more productive if we really made it reflect what we're thinking about doing. So I have a perfecting amendment that allows the first sentence, or half of the first sentence, to remain, and it would read as follows: the committee will recommend opposition to proposals that result in ending Medicare. There's no question about that. The committee will also recommend support for proposal to repeal provisions that provide an unelected 15-member body to ration care for those 55 and older, and will recommend proposals to ensure that Medicare does not go bankrupt in 2024. We all are concerned. We all believe that seniors deserve health care, and they deserve to have health care not just today and tomorrow, but for those individuals who are younger than 55 years old, those individuals that will be expecting to receive health care benefits after the date that the trustees predict that the program will be bankrupt. Now, you can't cut oil subsidies, tax the rich, cut foreign aid, and save Medicare. This takes hard bipartisan work on the part of the committee. And it's my hope over the next few months that we're going to be able to come together and work on a plan that will preserve and protect Medicare, keep it from going bankrupt as the trustees predict it will in 2024, and have an honest debate about whether or not we want an unelected body put in place by the Obama health care law, which can in essence determine what procedures are allowed and what procedures aren't allowed under Medicare. I'm sure that saves a lot of money, and it does it very quickly, and I know it affects everybody, including current seniors, but I believe that the only responsible course of action that we can take now at this time is to move to preserve and protect Medicare. The only option that we don't have at our disposal now, if we're responsible legislators, is to do nothing. So I urge my colleagues to support my second-degree amendment to the existing amendment offered by my friend from New York, and then vote for passage should this amendment.
The gentleman yield.
Gentleman
Yes, sir.
yield,
Yes, I'll
Mr.
yield.
Bass.
Gentleman from California.
Thank you for yielding. I have a concern about the drafting of your amendment. It says strike all after Medicare. Now, there are two Medicares twice mentioned in the pending amendment. The committee will recommend opposition to proposals that result in ending Medicare. Would you stop it there and then insert your language? Or would it be after the whole amendment and then insert your language?
The period would occur after the first use of the word Medicare, so it would read as follows. The committee will recommend opposition to proposals that result in ending Medicare, period. The committee will also recommend, and so forth.
Support for proposals to repeal.
So it eliminates the words and replacing it with a voucher doubling seniors' health care costs in Medicare and substitutes in lieu thereof. The committee will also recommend ... 2024.
Were you, if I can inquire further, were you unhappy with the language that said replacing it with a voucher doubling seniors' health care costs? Did you think that was a little too strident?
I have no question that we will not have vouchers and we will not double seniors' health care costs. But it's my feeling that due to the political nature of the debate right now, that there will be allegations made that these are indeed vouchers even though they aren't. What we're proposing to do, and my friend from California knows, is a model that was surprisingly similar to the bipartisan model that was proposed by Senator Breaux and Congressman Thomas back in the late 90s, and was also proposed for the Medicare Part D prescription drug plan. But I want to make it clear that we can support a provision that says that we are not going to vote to end Medicare, which is exactly what this amendment says.
Mr. Chairman, when the gentleman yields
Yes,
back,
I'll
I'd
yield
like
to
to
you.
be recognized.
Gentleman yields back his time.
I said I'd yield to the gentleman.
Well, we have so little time.
All right, I yield back.
Does the gentleman still insist on his point of order?
I'm going to reserve my point of order, but I do want to be recognized on the
Gentleman
amendment.
recognized for 5 minutes.
Well, the reason I asked whether the gentleman from New Hampshire objected to the words Medicare going into a voucher, well, it does. Premium support is the same thing as a voucher. It would double seniors' health care costs. So he didn't want those statements made. But then what he says is that there's proposals that in his amendment that ration care for 55 and older. Well, I know of no committee that's going to ration care for 55 and older. That's a misstatement of fact. An unelected 15-member body to ration care, well, they will, there is a committee that has to be appointed and confirmed by the Senate that'll make recommendations on Medicare, but it doesn't ration care. That's a very charged way of putting it. If he thinks our calling premium support a voucher, which is accurate, is an unfair characterization, I must say I consider it unfair to say that there's going to be a committee that's going to ration care under Medicare. We've had the committee to make recommendations on Medicare for some time now. It's different than the IPAB, but it's a committee that makes recommendations for changes in Medicare. Sometimes the Congress approves of their recommendations, sometimes we don't. But no one has ever said that that committee is a committee that's in charge of giving recommendations of ration care.
Will the gentleman
for
yield?
55 and older. So I think that this is this doesn't really add up to a legitimate point of view. Who's asking me to yield?
Cassidy down here on the
Cassidy,
far
I'll
hinterlands.
yield to you.
Okay, thank you. You know, I work in a public hospital, and I've learned how government rations. They don't say, thou shalt not have this procedure. They say, we are going to cut your global budget. IPAP is charged with cutting a global budget. And the way in such a system, I speak from experience, but we can see, I can show you lots of examples. The way they therefore
Well, the gentleman's
ration,
speaking to the mic because I'm trying to listen, but I can't have
I couldn't hear you either, so something may be wrong with the mics, but I'm trying to speak into it and I'm on. The way the government institutions ration with the global budget is they make the line longer. So the person who has congestive heart failure doesn't get surgery to fix her heart failure next month. She gets it next year. The person with the broken hip doesn't get it immediately repaired. They get it repaired, if at all, in a postponed fashion.
Reclaiming my time, a person who doesn't have health insurance gets whatever they can get. They have to go to an emergency room when they get very sick. They don't have a chance to go to a doctor for
Will the gentleman yield?
services that might keep them healthy. They wait till they're very, very sick because they can't get access to care.
Will the gentleman yield?
That's the problem of the uninsurance. But in a public hospital where we have government deciding appropriations, and always there are people who say they care about the poor, but then voting for lower appropriations for low-income people, we always have these public hospitals starved. And that gentleman has told us he's seen, and I strongly disagree with that kind of a process. But when we have a committee to recommend changes to Medicare, as the IPAB would do, that would affect whether people who have Medicare coverage can get access to the services that, at least under Medicare now, they're eligible for. They're entitled to them. Now, if we had a premium support or a voucher plan or what was in the Republican budget, which they want to say is similar to something else, it wouldn't be guaranteeing services. It would be guaranteeing a sum of money to help people buy a private insurance policy that may cover them for those services, but may cover with very limited amount of money to go for those services.
Would the gentleman yield?
Who's asking?
Right down here.
Yes, please
Or
yield.
Yeah, I guess the question would be, isn't that a bit like Medicare Part D, which seniors have taken great advantage of, that has come in under budget? The premiums that the Democrats wanted to lock into statute when we had that markup have not even been, that level hasn't been reached. We're trying to figure out a way to save Medicare for future generations and not let it go bankrupt, which it does under the Democrat plan that's in law today. Under
Well, that's
Obamacare
not
with the
accurate.
IPAB.
Reclaiming my time, that's not an accurate statement because the Affordable Care Act has so many ways that they try to reduce health care costs legitimately.
Will the gentleman yield?
No, not yet. And in reducing those costs, the projections for the IPAB to go into effect with recommendations that could actually have teeth in them is pushed way, way out because the whole bill that's now law is going to hold down health care costs. Let's hold down health care costs, not simply deny people care, which is what I think would happen under the budget by the Republicans.
Gentleman's time has expired. Other members?
I move to strike the last word.
Gentleman from Oregon is recognized.
Thank you, Mr. Chairman. I think it's an important debate to have, and I concur with my colleague from New Hampshire, Mr. Bass, that it seems kind of an odd place where we would normally have a routine agreement on what we're going to look into. It's turned into a partisan a spat, which is unfortunate and unnecessary. But if we're going to have a discussion about Medicare, let's have it. The Obamacare, which this committee really didn't get an opportunity to deal with in an open and transparent way, given what happened with the Senate, ends up creating this IPAB. And the IPAB is a 15-member appointed board that will make six-figure salaries and answer to themselves, basically. And they're going to decide what physicians get reimbursed on, among other things. The federal health care law that's in effect today takes $500 billion out of Medicare, Medicare Advantage. A lot of people in my district say without Medicare Advantage, some physicians wouldn't see them. And we know, and I think Dr. Burgess could back me up on this, some 1/3 of physicians are no longer or are capping their practices when it comes to Medicare. So we now are facing an access problem, and it's only going to get worse. It seems to me that the Medicare actuaries and the trustees have both said Medicare's going broke. unless we change. And that's after they take into account the federal health care law that was approved in a very partisan manner in the last Congress. And so what we're trying to say is there's a better way. If we have listened to seniors, and in our proposal, seniors are taken care of. If you have Medicare today and you're 55 and older, and you'll still be eligible for Medicare as it exists. But if we don't do anything, if we go the path of the current law that the Democrats have put in place, Medicare goes broke, and seniors lose out, and the next generation lose out. Look, my parents, both of whom are gone, were both on Medicare. I saw the importance of Medicare. I saw the importance of home health. I saw the importance of hospice. My wife's parents, both were on Medicare. My mother-in-law, they're both passed away now, but my mother-in-law was the hardest core Democrat of anybody I'd ever met. And after Medicare Part D came along, and she suffered from severe rheumatoid arthritis from the time she was in her 20s and had enormous health problems, and as a result had very high prescription drug costs. And when Medicare Part D came along, she signed up for it. And at a dinner one night, I finally asked her, Joanne, that worked out pretty well for you? And she had to confess that it was at least one thing a Republican had done that she agreed with, and it had made an enormous difference in their life. We want that going forward for the next generation of seniors to have a Medicare program that makes an enormous difference in their life, that is affordable, that takes care of the poorest and the sick, and doesn't bankrupt the country and the grandkids.
Gentlemen,
Now, you go back to IPAB, and you've got these people that are appointed that don't answer to anybody, maybe the Secretary of HHS. They make a six-figure salary. They serve longer than the president, 6 years, and can be reappointed for another 6. And I don't know who you even can appeal their decisions to. And so I think that's what scares me and scares seniors I talk to, is you're getting a whole government board now between them and their physicians and how they're going to get access. I mean, that's really what happens here. And I know Dr. Cassidy has a lot of experience in this area, may want to weigh in on the IPAB some more, but this is what you all put in law. Dr. Cassidy, I would yield.
Thank you. Under current law, under Obamacare, Medicare goes bankrupt. Now, that's under current law. Now, partly that's worsened because Obamacare takes $500 billion from Medicare to spend on another government program. But that said, IPAP, to think that that is not going to end up affecting patients' access to care is to be disingenuous with the American people. Medicare is too important of a program to sit here and say, don't worry, we're going to cut provider reimbursement, but you're not going to have a problem with access. As it turns out, already, MedPAC says that there are problems with access for Medicare beneficiaries in the current system. By the way, under the CBO report, they say under current law, there will be record taxes, record deficits, and all because of entitlement spending. And because of that, there is a likelihood that seniors on Medicare will see their benefits cut. Now, the answer is not to kick the road down, sing, whistle, and hope
Dr.
nothing goes
Cassidy,
wrong.
If I could reclaim my time, I want to conclude with this point. During the health care reform debate, 60 House Democrats commented that IPAB would, and I quote your letter, of which Mr. Pallone was a signatory, threaten the ability of Medicare beneficiaries to access the care they need, close quote. With that, my time's expired.
Mr. Chairman.
Gentleman's time expired. Gentleman from New Jersey.
Thank you, Mr. Chairman. I think this debate today has been very productive, and I have no problem if you want to have a hearing on iPad. I think we're supposed to have one, and hopefully we will after the next break. But my point,
gentlemen, I yield. We are going to have a hearing on iPad.
right? But my point,
To be able to
my point, Mr. Chairman, if I could take my time back, is that this debate today has been very helpful. But what the Democrats are trying to do is to basically expand the debate in the full committee and in the subcommittee on health, so that we're not just spending all our time talking about repealing the Affordable Care Act, but rather are getting into the meat, if you will, of the Republican budget plan. And yes.
Look, I just want to correct some statements that have been made many times on the other side of the aisle. If we did not have the Affordable Care Act, the Medicare Trust Fund is going to go broke. And in fact, the Affordable Care Act extended the Medicare Trust Fund for 20 years. Secondly, the problems, if we didn't have the Health Care Act, would still be there for Medicare, and we always look for ways to get greater efficiency. The IPAB is one that many people find offensive, but it is a way to get efficiencies. But in the bill, we got efficiencies to make the system run better. But for the Republicans to say there are $500 billion taken out of Medicare and that's why it's going to go broke, the Republican budget adopted every single one of those cuts and then added more when they were deciding on the voucher system. So that's why I think it's important to have the amendment to look at this proposed voucher system and the impact it has. Thank you for your time.
Thank you. My whole point, the point I'm trying to make here today is, look, with our amendments to this activity report, we're simply asking that the full committee, or in this case also the health subcommittee, look into the Republican budget, whether it's the CHIP and the impact on kids, or in Mr. Engel's case, Medicare. And I would point out, for those of you who say you like the debate or you like the fact that we're having this discussion today, well, when you vote on these amendments to change what myself or Mr. Engel did, where we're trying to deal with the Republican budget, if you make those changes and you make it so that we can't deal with that and that's not part of the activity report, then you're precluding us from having those hearings, because you know you're going to have all the hearings you want on repealing the Affordable Care Act. You've already had so many, but we're simply saying, let's have hearings on the Republican budget. Let's have hearings on what the impact of that budget would be on Medicare. Let's have hearings on what impact it'll have on SCHIP and cutting Medicaid. I mean, obviously, you're going to have your iPad hearing. You're going to have all the hearings you want on repealing everything under the Affordable Care Act. But I want to point out that, you know, some of you have said you like this debate today. You'd like to have more debate on these topics. Well, then don't bring up secondary amendments that preclude the activity report from saying that we should look into these things. We're simply asking that there be a full hearing, a series of hearings on the Republican budget and all the negative or positive. If you think it's positive, I don't know why you want to take out vouchers. You know, if all of a sudden you don't like vouchers, I thought you did like vouchers. You know, if you want to replace it with premium support, go ahead. But all I'm asking is don't eliminate those sections that we're bringing up today that would let us look into the Republican budget. If you're proud of the budget, then let's have the hearings. Call it whatever you want, premium support, vouchers, I'll call it end of Medicare, whatever you want, but let's at least have some discussion. This discussion today, I think, is tremendously productive, but it won't happen if you keep amending our amendments and make it so that, you know, the activity report doesn't include those hearings. You can bring up whatever you want anytime. Our problem is we'd like to have some hearings on what you think is a good thing. We may not think it's good, but we don't have hearings on it in any case.
Will the gentleman yield?
Sure.
At least the House this session considered a budget, in fact, multiple budgets, and passed one. And even the Senate took up the president's budget, which got no votes, and the House budget, which got 40 votes, but I'm not sure the Senate Democrats ever launched.
Well, my only point is...
And that seems to be a more responsible course of action.
Well, let me just take back my point. My only point is that we have not had much discussion about it in this committee. And I'd simply like the activity report to reflect that we should have more discussion, whether it's ending Medicare or it's severely cutting Medicaid, all the things that we're bringing up here today. This is a great discussion.
Will you yield again?
I want it to continue. I don't want it to end, but if you keep voting to eliminate these amendments, it's going to end today, and we won't have this discussion again.
Will the gentleman yield?
I don't think I have any time.
Well, how much debate did the committee have on PPOC when it came over from the Senate? That was actually the health care law.
Gentleman's time has expired. Seeing no other member wishing to ask for time, the vote is on the Bass secondary amendment to the Engel amendment. Those in favor of the Bass amendment will say aye. Aye. Those opposed will say no.
No.
You need a chair. The ayes have it. The ayes, the roll call is, the ayes have it. The amendment is agreed to. The vote now occurs on the...
Mr. Chairman, I seek recognition.
For what purpose is it, gentlemen?
I have an amendment at the desk.
Reserve a point of order, Mr. Stearns. Clerk will read the title of the amendment. Is it an amendment or a substitute?
It's an amendment.
Angle Amendment as perfected by the
It's an amendment to the Engel Amendment as perfected by the Bass Amendment.
Clerk will read the title.
An amendment to the
Order,
amendment by
Mr.
Mr. Waxman of California.
Amendment will be considered as read. The staff will circulate the amendment, and the gentleman is recognized for 5 minutes.
We would put into this amendment as amended the language that the committee will recommend opposition to provisions in the Republican budget that result in ending Medicare and replacing it with a voucher, doubling seniors' health care costs in Medicare. I ask for its immediate consideration and an affirmative vote without debate.
Point of information, Mr. Chairman, just while we're discussing this, can we ask someone parliamentarian, if you amend an amendment and it's defeated, can you amend the amendment with a third degree? Is that possible to do? Is that?
This is a second-degree amendment to the amendment that has been perfected by the amendment that was just adopted.
Well, the First Amendment was amended by Mr. Bass, and it was accepted. It was accepted. You would have to put yours at the
Well,
same
if the
time
gentleman-
Bass was doing it. You couldn't do it after Bass lost, as I understand.
If I did it while Bass was pending, it would be a third-degree amendment. But since the amendment was adopted, it was not a substitute. It was an amendment, and now I'm offering another amendment, which has the same status as.
So that's the question: is can you amend again? It's not a third degree, is what you're saying, but it's another amendment to a second degree. And on your side think that's... Now what happens, Mr. Waxman, if your amendment is not true?
If my amendments are not what?
It's not true.
True?
Not true.
Oh, in this committee?
Yeah.
In this committee?
In this
something
committee.
That's not true?
Yeah, this is no validity to your amendment. Doubling seniors' health care costs, you and I both know this is not true.
Well,
So you're offering an amendment that doesn't tell the truth.
I beg to differ, but I don't think we have. We're waiting for the chair to make a decision.
But I'm just trying to make you feel a little guilty here for your amendment.
Have you been to the gym yet?
Yeah, no, that's why I'd like to clear this up so you and I can go down.
Okay. Gentleman withdraw his point of order.
Per your request.
The hands, isn't it? Is there further discussion on the amendment? If not, the vote occurs on the amendment by Mr. Waxman. Those in favor say aye.
Aye.
Those opposed say no.
No.
Senior Chair, clerk will call the roll.
Mr. Chairman, since we're going to do a roll call vote,
Yeah.
I still raise the question, and I know that I'm learning this process, so I'm just trying to learn, but if Mr. Waxman's amendment was broader, should it not have been offered simultaneously with the Bass Amendment and then the broader amendment taken up first, and then if the broader amendment's adopted, the more narrow amendment would not be permitted in front of us, and since it's not in the right time frame, is it proper to take a recorded vote?
I'm told that we're operating correctly, so.
All right.
Clerk will call the roll.
Mr. Barton.
No.
Mr. Barton, nay. Mr. Stearns.
No.
Mr. Stearns, nay. Mr. Whitfield. Mr. Shimkus. Mr. Shimkus, nay. Mr. Pitts. Mr. Pitts, nay. Mrs. Bono-Mack. Mr. Walden. Mr. Walden, nay. Mr. Terry. Mr. Terry, nay. Mr. Rogers. Mr. Rogers, nay. Mrs. Myrick. Mrs. Myrick, nay. Mr. Sullivan. Mr. Murphy. Mr. Murphy, nay. Mr. Burgess. Mr. Burgess, nay. Mrs. Blackburn. Mr. Bilbray. Mr. Bass. Mr. Bass, nay. Mr. Gingrey. Mr. Scalise. Mr. Scalise, nay. Mr. Latta. Mr. Latta, nay. Mrs. McMorris Rogers. Mrs. McMorris Rogers, nay. Mr. Harper. Mr. Lance. Mr. Lance, nay. Mr. Cassidy. Mr. Cassidy, nay. Mr. Guthrie. Mr. Guthrie, nay. Mr. Olson. Mr. Olson, nay. Mr. McKinley. Mr. Gardner. Mr. Gardner, nay. Mr. Pompeo. Mr. Pompeo, nay. Mr. Kinzinger. Mr. Griffith. Mr. Griffith, nay. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Ms. Eshu. Mr. Engel. Mr. Engel, aye. Mr. Green. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Mr. Ross. Mr. Ross, aye. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Mrs. Christensen. Mrs. Christensen, aye. Ms. Castor. Ms. Castor, aye. Mr. Upton. Mr. Upton, nay.
The other members wishing to cast a vote? Ms. Bono-Mack?
Ms. Bono-Mack, nay.
Ms. Capps?
Mrs. Capps, aye.
Mr. Whitfield?
Mr. Whitfield, nay.
Mr. Matheson?
Mr. Matheson, aye.
Other members seeking to vote? Ms. Blackburn?
Mrs. Blackburn, nay.
Other members? Seeing none, the clerk will report the tally.
Mr. Chairman, on that, there were 14 ayes, 25 nays.
Wait, excuse me, before. Mr. Bilbray?
Mr. Bilbray, nay.
Now the clerk will report the tally.
Mr. Chairman, on that, there were 14 ayes, 26 nays.
14 ayes, 26 nays. The amendment is not agreed to. The amendment, or the vote now occurs on the Engel amendment as second agreed by Mr. Bass. Those in favor will say aye. Aye. Those opposed say no.
No.
Opinion of the chair. You want a roll call? Roll call is requested. The clerk will call the roll.
Mr. Barton. Mr. Barton, aye. Mr. Stearns. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shimkus, aye. Mr. Pitts. Mr. Pitts, aye. Mrs. Bono-Mack. Mrs. Bono-Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mr. Sullivan. Mr. Murphy. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Mrs. Blackburn. Mrs. Blackburn, aye. Mr. Bilbray. Mr. Bilbray, aye. Mr. Bass. Mr. Bass, aye. Mr. Gingrey. Mr. Scalise. Mr. Scalise, aye. Mr. Latta. Mr. Latta, aye. Mrs. McMorris Rogers. Mrs. McMorris Rogers, aye. Mr. Harper. Mr. Lance. Mr. Lance, aye. Mr. Cassidy. Mr. Cassidy, aye. Mr. Guthrie. Mr. Guthrie, aye. Mr. Olson. Mr. Olson, aye. Mr. McKinley. Mr. Gardner. Mr. Gardner, aye. Mr. Pompeo. Mr. Pompeo, aye. Mr. Kinzinger. Mr. Kinzinger, aye. Mr. Griffith. Mr. Griffith? Aye. Mr. Waxman? Mr. Dingle? Mr. Markey? Mr. Towns? Mr. Pallone? Oh, sorry. Mr. Waxman, present. Mr. Pallone? Mr. Pallone, present. Mr. Rush? Mr. Rush, present. Ms. Eshu? Mr. Engel? Mr. Engel, present. Mr. Green? Ms. DeGette? Mrs. Capps? Mrs. Capps, present. Mr. Doyle? Should I skip him? Mr. Doyle's on the call. Ms. Schakowsky? Ms. Schakowsky, present. Mr. Gonzalez? Mr. Inslee? Mr. Inslee, present. Ms. Baldwin? Mr. Ross? Mr. Matheson? Mr. Butterfield? Mr. Butterfield, present. Mr. Barrow? Mr. Barrow, aye. Ms. Matsui? Mrs. Christensen? Mrs. Christensen, present. Ms. Castor? Ms. Castor, present. Mr. Upton?
Votes aye. Other
Aye.
members wishing to cast a vote, Mr. Terry.
Mr. Terry, aye.
Mr. Pallone.
I'd like to be recorded as aye.
Mr. Pallone, aye. Off, present, on, aye.
Other members wishing to cast a vote, Mr. Ross.
Mr. Ross, aye.
Other members wishing to cast a vote, seeing none, the clerk will report the tally.
Mr. Chairman, on that, there were 28 ayes, 0 nays, and 9 presents.
The amendment is adopted, 2809. Amendment as amended is adopted. It is my understanding that we have a unanimous consent agreement. I'm going to make a unanimous consent agreement that the remaining amendments be considered en bloc, and that there'll be 5 minutes in support and 5 minutes opposed, at which point vote's likely to occur and we'll get to final passage and be done. So with that announcement, gentleman from California offers the remaining amendments.
Mr. Chairman, I have a series of amendments at the desk. I'll ask unanimous consent that they be considered as read, and I'll explain them.
Good.
In the 5 minutes?
Yeah, I'll ask the clerk, so that's all the remaining amendments, is that right?
Yeah, all the remaining amendments will be considered in block.
And considered as read. The clerk will distribute the amendments, and the gentleman from California is recognized for 5 minutes in support of his amendment.
Mr. Chairman, we are recommending that the committee oppose proposals that result in benefit cuts to Medicare and Medicaid for seniors and individuals with disabilities. The committee will examine how the cuts in the Republican budget on Medicare and Medicaid will impact veterans' families. The committee will examine how the Republican budget will affect the health care benefits, premiums, and out-of-pocket costs for the 40 million seniors served by Medicare and the 6 million seniors served by Medicaid. The committee will examine the impacts of the Republican budget on nursing home quality standards for the 3 million seniors served in nursing homes by Medicaid and the 2 million seniors served in nursing homes by Medicare. The committee will examine the effects of cuts in investments in the clean energy sector in the Republican budget on the nation's global competitiveness and technological leadership. The committee will examine gaps in security legislation and regulations that leave critical infrastructure vulnerable, including public drinking water systems. The committee will examine successful strategies adopted by other major countries around the world to control and reduce greenhouse gas emissions in order to mitigate global climate change. And the committee will examine the role of climate change in causing or contributing to the floods, droughts, and wildfires occurring across the United States. And then the last one is the committee will recommend opposition to proposals that could result in millions of children losing Medicaid or CHIP health care coverage under the Republican budget. These are obvious amendments that we think ought to be part of the committee report and under consideration by the committee, either by way of oversight, investigations, or possible legislation, which is appropriate as the committee sees fit. But this is to amend the proposal that is before us, which is the committee activities, and I think all of these amendments are appropriate committee activities, and I would urge my colleagues to support them. I'll yield to anybody who wants, or I yield back, either way. Yield back.
Gentleman yields back. I will seek time to speak in opposition. I just want to say a couple things. You know, from the very beginning, I've done my very best to be bipartisan in all the things that we've done, from recognizing the members that might offer bipartisan amendments to going regular order on virtually every bill that's emerged from this committee, from the hearings to acceptance of witnesses, to making sure that even sometimes subcommittees don't conflict with each other, knowing that we're very busy on lots of different issues, as we have 6 major subcommittees with 6 very able chairs, vice chairs, and ranking members, and particularly staff. We have, I want to say, on every bill that's been reported out of this committee, there's been at least some bipartisan support, some more than others. And on the bills that we've seen get to the House floor, we've had what I think is pretty significant Democratic bipartisan support on virtually everything, as we saw last night with the Alaska bill with nearly 24 members on board. But looking at the bill today on Keystone Pipeline and the support of a good number of members on both sides of the aisle, as I look at the issues that we're going to be dealing with in the weeks ahead, whether it be coal ash, whether it be toys, whether it be spectrum, whether there are active negotiations, discussions that are going on, particularly with the relevant members of the committee. Pipeline safety is an issue that I think will herald as a good success in this Congress, not only with this with our work with this committee, but also with the Transportation Committee. As I look at the work that's going to be done on PDUFA, something that we desperately need, particularly as we look at exports and good drugs and solving diseases around the world, as I look at the medical device user fee and the discussions that are beginning on that, knowing that legislation expires in September of next year. Looking at the hearings that we start right after the break on IPAB, again, we're looking for witnesses that both sides are able to call, and certainly a good debate as it relates to all of the issues before the committee. We're going to continue that. And in the oversight plan that was adopted, I want to remind folks, on a unanimous vote, a voice vote, with very good comments, particularly on the Democratic side of the aisle, I thought we were off to a very good start. And I just want to commit that we will continue to work in a bipartisan way. It doesn't necessarily mean that you're going to get a vote that's unanimous. We understand that. But this committee is engaged on those issues, and we will continue to do so. I'll yield for a moment on my time, and then I want to get to the votes.
Yes, well, I thank you for yielding. I appreciate what you're saying. It means a great deal to hear you say you want to work on a bipartisan basis.
To work.
Well, we had the Affordable Care Act. We had the funding on Clean Air Act on regulation of carbon emissions. We had the net neutrality. Those were all very partisan and didn't get us off to a good start. but I do look forward to working on a bipartisan basis. I appreciate your comments, and we hope that the members will accept these other ideas for the committee report. Whether they do or not, let us, from this moment on, try to work on a bipartisan basis for the rest of the Congress. And I'll do my best.
Will the chairman yield?
It's my time. I'll yield to the gentlelady from Colorado.
Yeah. If the chairman's done, I was going to strike the last word to talk about the oversight plan, but I can probably do it right now.
I'll yield.
Okay. Since the chairman mentioned the oversight plan, we've been working very closely together on a bipartisan basis on the oversight committee. We've had a number of good meetings, hearings, although we have had some repetitive hearings on waste, fraud, and abuse. And yesterday, for example, we had an excellent hearing on Medicare and how we can save money. But, Mr. Chairman, we've been really hampered in our oversight efforts, and I'm just going to be frank with you about it. For whatever reason, there are a number of issues that the chairman and I had agreed on, that you had agreed on: drug shortage hearings, vaccine development, H1N1, a follow-up on the New Orleans healthcare situation, and also on the Deepwater Horizon, nuclear safety in light of Fukushima. We had one hearing on that, but we could have many, many more hearings on the safety of U.S. nuclear facilities and nuclear waste disposal. You and I had talked about a food safety hearing, given what happened with the E. coli in Germany and this committee's long-standing progress. Just one I heard about yesterday, tobacco labeling, on and on. And I am told by Chairman Stearns and others, one reason why we've been unable to have robust oversight in this Congress is because many of the O&I staff have been pulled off to do some oversight hearings on Yucca Mountain, which are in a different subcommittee, and so we can't do it in oversight and investigations. And I think you would agree, Mr. Chairman, and Mr. Dingle and Mr. Waxman and all of us, that oversight is the bread and butter of this committee. And I would just ask you and your staff and the members on your side, if you can't work with us to get more robust investigations going and some hearings that can be bipartisan, that can really help us move our agenda forward. And I thank you for yielding, and I yield back.
I know my time has expired, but I want to continue to work with the gentlelady, and I commend your work and Mr. Stearns. I know that on a number of those issues we have letters outstanding where we've sought information, particularly on food safety, that I have signed and others. I look forward to legislation that will be developed to fix the problems that you all discover and identify, as we are with the Medicare fraud and abuse legislation that I expect, again, to be bipartisan, and you be a lead with others to get that done, where we actually save the taxpayers' money. And I can absolutely pledge that we continue to work to have a very aggressive oversight plan. And I appreciate the gentlelady's comments. At that point, I would note that my time has expired. All time has expired on the amendments on block. So those in favor of the amendments in block, we'll say aye. Aye. Those opposed say no. No. Roll call vote is requested. The clerk will call the roll.
Mr. Barton. Mr. Barton, nay. Mr. Stearns. Mr. Whitfield. Mr. Shimkus. Mr. Pitts. Mr. Pitts, nay. Mrs. Bonomack. Mrs. Bonomack, nay. Mr. Walden. Mr. Walden, nay. Mr. Terry. Mr. Rogers. Mr. Rogers, nay. Mrs. Myrick. Mr. Sullivan. Mr. Murphy. Mr. Murphy, nay. Mr. Burgess. Mr. Burgess, nay. Mrs. Blackburn. Mrs. Blackburn, nay. Mr. Bilbray. Mr. Bilbray, nay. Mr. Bass. Mr. Bass, nay. Mr. Gingrey. Mr. Scalise. Mr. Scalise, nay. Mr. Latta. Mr. Latta, nay. Mrs. McMorris Rogers. Mrs. McMorris Rogers, nay. Mr. Harper. Mr. Lance. Mr. Lance, nay. Mr. Cassidy. Mr. Cassidy, nay. Mr. Guthrie. Mr. Guthrie, nay. Mr. Olson. Mr. Olson, nay. Mr. McKinley. Mr. Gardner. Mr. Gardner, nay. Mr. Pompeo. Mr. Pompeo, nay. Mr. Kinzinger. Mr. Kinzinger, nay. Mr. Griffith. Mr. Griffith, nay. Mr. Waxman. Mr. Waxman, aye. Mr. Dingle. Mr. Markey. Mr. Towns. Mr. Pallone. Mr. Pallone, aye. Mr. Rush. Mr. Rush, aye. Ms. Eshu. Mr. Engel. Mr. Engel, aye. Mr. Green. Ms. DeGette. Ms. DeGette, aye. Mrs. Capps. Mr. Doyle. Mr. Doyle, aye. Ms. Schakowsky. Ms. Schakowsky, aye. Mr. Gonzalez. Mr. Inslee. Mr. Inslee, aye. Ms. Baldwin. Mr. Ross. Mr. Ross, aye. Mr. Matheson. Mr. Matheson, aye. Mr. Butterfield. Mr. Butterfield, aye. Mr. Barrow. Mr. Barrow, aye. Ms. Matsui. Mrs. Christensen. Mrs. Christensen, aye. Ms. Castor. Ms. Castor, aye. Mr. Upton. Mr. Upton, nay.
Other members wishing to cast a vote? Mr. Whitfield.
Mr. Whitfield, nay.
Ms. Capps.
Mrs. Capps, aye.
Other members? Mr. Terry.
Mr. Terry, nay.
Other members? Mr. Shimkus.
Mr. Shimkus, nay.
Other members seeking to cast a vote? Seeing none, the clerk will report the tally.
Mr. Chairman, on that, there were 25 ayes, 15,
No.
sorry, 20,
No. No.
15 ayes, 25 nays.
15 ayes, 25 nays. The amendments in block are not agreed to.
Mr. Chairman,
Gentleman from Texas.
I'd like to strike the requisite number of words briefly.
Gentleman is recognized briefly.
Mr. Chairman, I'm not going to take a long time, but I think members of the committee need to realize what's just happened. In prior Congresses, the committee had to issue a report of its activity, but it was done by the chairman with the acknowledgement of the ranking member. It was not subject to committee vote. It was simply compiled, shown to both staffs, the ranking member, the chairman. Generally, if there was a discussion, agreed on what was in the report. And if there were minority views, they put in, they went out. Under the Republican Congress, this time we've changed the rules of the House that the committees have to make these reports subject to the committee process to be open and transparent. That wasn't done when Mr. Waxman was chairman, when I was chairman, when Mr. Tozan or Mr. Dingle. This is the first time this process has been used. Now, if you look at the actual report that we've just spent 3 hours amending, or 2 hours amending, it's a dry recital of what the committee's actually been doing. It has the subcommittees, the full committee rosters, and then just basically a chronology of the hearings that have been held. And there is no real political opinion in it. It's a dry recital. Now, Mr. Waxman has taken the opportunity, which is his right as the minority member, to offer amendments which are in order under the rules, but if almost every one of the amendments the gentleman from California just offered uses the term the Republican budget. Not all of them, but most of them, the majority of them. He's within his rights to do that. There's absolutely nothing in the rules that prohibit it. But our chairman for both sides of the aisle, not just for the Republicans, our chairman, Mr. Upton, has been running this process straight down the middle. And I think he should be commended, and I would hope as we mature as a committee working together, the exercise that we've just seen, again, it's within the rules, but to offer amendments on a pure ministerial function of the committee where there's no real objection to the report, is somewhat unusual. And I want to commend Mr. Upton for his handling of this issue. And with that, I yield back.
I thank the gentleman for his nice word. If there are no further amendments, the question now occurs on favorably reporting the activity report to the House. All those in favor say aye. Aye. Those opposed say no.
No.
The ayes appear to have it. The ayes have it, and the activity report is favorably reported.
Mr. Chairman, I want to serve notice that their minority views will be submitted.
Without objection, the staff is authorized to make technical and conforming changes to the bill and to the activity report, and the minority will certainly have its requisite number of days. I would thank all members and staff. Again, the bill is favorably reported, and the committee stands adjourned.